Hey guys, Jim Hoffman here from Turbomatic, and today I want to share a streamlined breakdown of cardiogenic shock management. And I really think this is something that deserves a spot sort of in that little clinical toolkit, if you will, that you can go back to and pull from. So let's cut down to the core of it when it comes to cardiogenic shock. Well, what is it? Cardiogenic shock, it represents a critical failure of cardiac output, distinctly different from hypovolemic shock, right? Hypovolemic scenarios. When the heart's pumping capacity is compromised, this is when we start looking at this cascade of systemic effects that really start to demand our immediate attention and recognition, and of course, our response as EMS professionals. So, what are some of the key clinical indicators that you want to look for? Well, you're doing your patient assessment, the patient's hypotensive. That is a big red flag. Respiratory distress is a red flag, especially when they have pulmonary edema along with that. Peripheral hypoperfusion signs, notable JVD signs, compromised tissue perfusion. A lot of times you'll see like the capillary refill delays. You see some of these markers you're starting to consider, and you're realizing that this patient you have is in cardiogenic shock. What's going to be your clinical response? Well, it depends upon, of course, if you're an EMT, you're a paramedic. But either way, you want to give that immediate oxygenation. You want to target that SpO2 of at least 94% or greater. You want to start an IV, initiate your cardiac monitoring. If you are a paramedic, again, paramedic, you might want to consider giving a vasopressor during this patient contact. And of course, it depends upon your protocol and when that's indicated. Either way, whether you're a paramedic, EMT, some of the things you should be thinking of when it comes to cardiogenic shock patients are what's the causes? Acute MI, maybe dysrhythmia happening, they're severely bradycardic, mechanical dysfunction. Again, their pacemaker's not working right. They need a hospital notification and transport. Now, one of the key points I want to mention when it comes to a lot of the stuff that we can do for cardiogenic shock, other than fluid and maybe managing a severe heart rhythm, the time to intervention ends up being what is going to correlate with the outcome of the patient. So this is why I'm giving you these key points, because I want these key points to ring a bell in your head. Early recognition and rapid transport is going to be your best friend. Get those patients to the appropriate facilities, and that's going to be your key priority for this type of a patient. So I hope this is just kind of scratching the surface for you, kind of ringing some bells in your head and giving you some key markers to look for when you're doing your patient assessments. I highly encourage you, go review this stuff in your textbook or review guide. Our clinical competency when it comes to EMS and managing these types of patients can really make a measurable difference in our patient outcomes. Finally, guys, as always, I got a quick goodie for you. You want some more free study hacks? Go check out Turbomatic Insider. It's a free members-only website packed with lots of tips and resources to help you crush your EMS goals. You can go grab it all. It's over at myturbomatic.com. I'll have a link in the notes below. All right, that's it for me. As always, I'm Jim Hoffman from Turbomatic. Stay safe.